Hi medicos, today we are going to study about the mammary gland. Mammary gland is a general question that every medico will study. So let's discuss about it. Mammary gland is generally a modified apocrine sweat gland. It is generally present in pectoral region, that too in superficial fascia. It is present in both males and females. In males, it becomes enlarged in case of gynecomastia. Otherwise, it is rudimentary. In females, it forms accessory sex organs of female reproductive system and provides milk to newborn babies. This is general introduction of mammary gland. Coming to the location of the mammary gland, it is generally present in superficial fascia of pectoral region, as said before, and also a small extension from its superolateral part. Remember the superolateral part. Let us think this is the mammary gland. This is the superolateral part. This is medial side and this is lateral side, superior, inferior. Okay, from small extension from this superior lateral part pierces into the fascia. This extension is called axillary tail of Spence. This axillary tail of Spence pierces the deep fascia present here through the foramen called foramen of Langer. This is foramen of Langer. It is an aperture in the fascia through which the axillary tail of Spence goes through it. This is the mammary gland. Coming to the shape and extent of mammary gland, shape is general shape, we all know, that is hemispherical bulge. And coming to the extent, it generally extends vertically from second rib to sixth rib. Think this is the mammary gland. Its vertical extension is from second rib to sixth rib, and horizontal extension is from lateral border of sternum to mid-axillary line. It is the horizontal extension, it is the vertical extension. Coming to the relations of mammary gland, this is the pectoralis major muscle. This part is all pectoralis major muscle, and it is covered by pectoralis fascia on it. It is the fascia covering the pectoralis major muscle. And between the pectoralis major and breast, there is a space. It is called retromammary space. It is a loose areolar space. Due to this space, the breast is able to move upwards and downwards and side by side. Due to this space. Coming to the relations of the mammary gland, under the breast, that is superficially, we have pectoral fascia. Below it, that is in deep relation of mammary gland, we have three muscles. They are pectoralis major, serratus anterior, and external oblique. Most of the part of the breast lies on pectoralis major. Pectoral fascia is the deep fascia that covers the pectoralis major muscle. Let's discuss it diagrammatically. Coming to the structure of mammary gland, the mammary gland generally consists of three components. They are skin, stroma, parenchyma. Being a glandular tissue, it is otherwise called glandular tissue. It's often called mammary gland proper. Okay, these three are components of breast. Coming to the skin, it has nipple and areola. Okay, if you think this is the breast, nipple is present just below the center of breast. It is a projection present below just below the center of breast at the level of fourth intercostal space. It actually contains smooth muscle which make it stiff and erect or flatten it. It is richly innervated by sensory nerve endings. It is the most sensitive part of the breast, and due to this, it becomes erect during the sexual arousal. Okay, let's talk about the areola. Areola is the circular area. It is basically a pigmented area around the nipple. It contains large number of modified sebaceous glands, particularly on its outer margin. This whole area is areola. It has a large number of sebaceous glands. These sebaceous glands produce oily secretion, which lubricate both nipple and areola. Due to this, it prevents from cracking and drying. And during pregnancy, it is the sebaceous glands at its outer margin in areola. This is nipple. Let's think this is areola, and these are sebaceous glands in the outer margin of areola. They become enlarged. This condition is called Montgomery's tubercles. The elevated sebaceous glands are called Montgomery's tubercles. It occurs only in pregnancy. Okay, let's go to the stroma. Is nothing but connective tissue and fat. These two components present in stroma is again a component of mammary gland. These both form the supporting framework of breast. This connective tissue present in stroma, it condenses to form suspensory ligament of Cooper. Okay, if you think this is the breast, this is the nipple just below the center of breast. This is the areola. This is pectoral fascia. Beneath it, pectoralis major muscle. This is pectoral major muscle. This is pectoral fascia. Okay. The breast contains of lobes. We all know that they are. Let's think. This is a lobe. This is another lobe. This is another lobe. Okay. Now the condensed connective tissue, that is suspensory ligament of Cooper, they attaches the lobes to underlying dermis of skin and pectoral fascia. like this. They connect the lobes with underlying dermis, also with the pectoral fascia deep inside, like this. Okay. Thus gives the protuberance to breast. However, in conditions like due to aging, atrophy of the suspensory ligaments of Cooper occurs, due to which pendulous breast occur in old age. This is physiological condition. And coming to the fat, fat is another component of stroma. This forms the mass of breast whole bulk. It is distributed all over the breast except near nipple and areola. Remember this point, nipple and areola. Fat covers the whole surface, the whole area of whole volume of breast except the nipple and areola. Remember this point. Okay. We have discussed the skin, the stroma. Let's discuss about the parenchyma. We have discussed that in the structure, skin, stroma, and we will discuss about parenchyma a little bit later. Stroma, as I said, it is consists of connective tissue and fat. Connective tissue forms the suspensory ligaments of Cooper. I have already told that. Let's see it in diagrammatically. This is the suspensory ligament of Cooper. This is the lobe. This is the underlying dermis of skin. This is the pectoral fascia. Hope all of you understood that. And the area here, it is covered by fat. Fat almost forms the bulk of breast, as I said earlier, except near nipple and areola. Remember this point. Let's discuss about the parenchyma. It is also called glandular tissue or mammary gland proper. We will discuss this. Coming to that component of breast, that is parenchyma. Parenchyma, as earlier I told, it is also called glandular tissue or mammary gland proper. It generally consists of 50 to 20 lobes. Sorry, I forgot to say it. It secretes milk for the newborn babies. So it is called glandular tissue. It generally consists of 50 to 20 lobes. They are arranged in radial fashion like spokes of wheel. These all lobes converge into nipple. Think this is the breast. Here is the nipple. One lobe, another lobe, another lobe. These all lobes converge into nipple, as I said earlier. Okay, let's study it detailedly. The parenchyma contains the cluster of acini in the lobules. These all lobules drain into the lobe. This lobe drain into nipple by lactiferous duct. This is cluster of acini which secrete milk and pass to lobules. These are lobules. These are lobules. They have cluster of acini. They secrete milk and release to lobules. From lobules, they come to lobe. From lobe, it goes to lactiferous duct, through which it reaches the nipple. And while reaching the nipple in the lactiferous duct, at the termination, that is here, a small extension is present. Let me say it clearly. This extension is called lactiferous sinus. These are acini. These are lobules. These are lobe. These are lactiferous duct. And the expansion at termination of lactiferous duct near the nipple is called lactiferous sinus. It acts as reservoir of milk during lactation. I will show it in diagrammatical way. Here is the diagram of parenchyma tissue of breast, that is mammary gland. As I said earlier, these are the acini, these are the lobules, this is another lobule. These all lobules converge into lobe. This lobe through lactiferous duct open into nipple. This is the nipple. At termination of nipple, the lactiferous duct just expands. This is expansion of lactiferous duct called lactiferous sinus. This lactiferous sinus acts as a reservoir of milk during lactation. This is the diagrammatical representation of parenchyma. Hope all of you had understood. Coming to the blood supply of mammary gland. We will discuss about the arterial supply at first. Next, the venous drainage. Coming to the arterial supply, the breast is highly vascular. It is supplied by 5 arteries. Actually contains some of the branches. And the first one is internal thoracic artery. Actually by its branches. And second one is lateral thoracic artery. Third one is superior thoracic artery. And the fourth one is posterior intercostal arteries by its branches. And fifth one is pectoral branch of thoracoacromial artery. I will draw the diagram and show you. If you think this is the breast, this is the nipple this is the breast, this is the areola, this is the nipple as usual. Coming to the arterial supply. As I said, the branches from internal thoracic artery. They perforate through second, third, fourth intercostal spaces and supply the breast, hence called perforating branches of internal thoracic artery. Remember this name, internal thoracic artery, by its perforating branches. And second is the lateral thoracic artery. This is the axillary artery. You will study in the axilla in future. This is the superior thoracic artery. This is the lateral thoracic artery. Remember these names. lateral thoracic artery. This is superior thoracic artery. Coming to the another artery, that is this is thoracoacromial artery. It gives 4 branches. Out of this, one branch is called pectoral branch, as it supplies the pectoral region. It also supplies the breast. It is pectoral branch of thoracoacromial artery. Okay, and the last artery I have discussed is posterior intercostal artery. By its branches, it supplies to the breast. Posterior intercostal artery. As the branches arrive from the lateral side, they are called lateral branches of posterior intercostal artery. The first one is internal thoracic artery. Second one is lateral thoracic artery. Third is superior thoracic artery. Fourth is pectoral branch of thoracoacromial artery. And the fifth is lateral branches of posterior intercostal artery. Out of this, the lateral thoracic artery is the main artery that supplies the breast. Okay, let's discuss about is axillary by 3 veins, 3 main veins. Axillary vein, internal thoracic vein, and posterior intercostal vein. These 3 veins involved in venous drainage of mammary gland. These veins actually follow the arteries. These veins actually converge at the base of nipple to form anastomotic venous circle at base of nipple. From this anastomotic venous circle, 2 sets arise. They are superficial set and deep set of veins. I will explain it once again. These are all veins, venules. They form the anastomotic venous circle at the base of nipple. From this, 2 sets of venous drainage arise. They are superficial and deep sets. The superficial sets drain into internal thoracic vein. The deep sets drain into internal thoracic vein and posterior intercostal vein. Remember, the veins of breast are axillary vein, internal thoracic vein, and posterior intercostal vein. They converge at the base of nipple, forming the anastomotic venous circle. From that, 2 sets of venous arises. They are superficial and deep. Superficial drain into internal thoracic vein, and deep sets drains into internal thoracic and posterior intercostal veins. This is the blood supply of brain. Breast is primary somatosensory. It is primary somatosensory, and the nerves that supply the breast are from 2nd to 6th intercostal nerves. Actually, the branches of these nerves supply the breast. The branches arise from the anterior and lateral side, so they are called anterior and lateral cutaneous branches. These branches supply the mammary gland. These nerves innervate the skin, smooth muscles, and blood vessels in the mammary gland. And in nipple and areola, there are more sensory nerve endings. These sensory nerve endings in the nipple and areola makes the nipple more richly innervated by the nervous system and helps in milk ejection reflex, like stimulate release of milk in response to suckling by the infant. Lymphatic drainage of mammary gland is of great clinical importance because the carcinoma of breast spreads mostly by the lymphatics. In lymphatic drainage, we will study of lymph nodes present around the mammary gland and the lymphatics. That is the pathway by which the lymph flows, drains out of the mammary gland. The lymph nodes are axillary lymph node, internal mammary lymph nodes, supraclavicular lymph nodes, posterior intercostal lymph nodes, cephalic or deltopectoral lymph nodes. Okay. Axillary lymph nodes, internal mammary lymph nodes, supraclavicular lymph nodes, posterior intercostal lymph nodes, cephalic or deltopectoral lymph nodes. Actually, axillary lymph nodes are a group of 5 lymph nodes. They are apical, anterior, posterior, lateral, and central. Okay, we will see in a diagrammatic way. These are lateral lymph nodes, central lymph nodes, apical lymph nodes. These are posterior lymph nodes. These are anterior lymph nodes. These 5 group of lymph nodes form the axillary group of lymph nodes. And here is the posterior intercostal lymph nodes. This is the deltopectoral or cephalic lymph nodes. Some of the lymph from the breast drain into subperitoneal lymph nodes. Actually, the breast, if imaginarily divided into 4 quadrants, they are upper medial, upper lateral, lower medial. The upper medial part of quadrant of the breast drains into internal mammary lymph nodes. Often it drains into the opposite side, that is other side of internal mammary lymph nodes, like this. The upper lateral part of the quadrant of the breast drains into anterior lymph nodes. The lower lateral quadrant of the breast drains into anterior lymph nodes, posterior lymph nodes, and posterior intercostal lymph nodes. And the lower medial drains into internal mammary lymph nodes. Also, some of the lymphs drain into subperitoneal lymph nodes. And the lymph from the anterior and posterior lymph nodes drain into central lymph nodes. From central, it drains into deltopectoral lymph nodes. From there to apical lymph nodes. The lymphatic of breast is by superficial and deep set of lymphatics. The superficial lymphatics drain the skin of breast, but except nipple and areola. The leaf lymphatics of breast drain the parenchyma of breast and skin of nipple and areola too. We need to note another point here. That is under the areola, that is deep to areola, the lymphatic vessels deep to areola form the subaerial plexus of Sapi. This is subareolar as it is present beneath the deep to areola. As it is forming the plexus, it is called plexus of Sapi. Subareolar plexus of Sapi. Most of the lymph from the subareolar plexus of Sapi and most of the lymph from the breast drain into anterior group of axillary lymph nodes. Coming to the clinical aspects of mammary gland, the first one is, we are well known, that is breast cancer. Carcinoma of breast. It generally occurs in females. and it is a tumor of epithelial cells of lactiferous ducts, and it occurs generally in the ages of 40 and 60 years. And we all know we are well known about the gynecomastia, that is enlargement of breast in males, and retracted nipple. It is also called inserted nipple. In this case, the suckling of baby becomes difficult and it is prone to infection. And other clinical aspects are polythelia and polymastia.